Welcome to today's lecture on gastrointestinal and urologic emergencies. In this chapter, we'll cover the anatomy, physiology, common conditions, assessment, and emergency medical care related to these systems. Understanding these emergencies is crucial as they can present with a wide range of symptoms and lead to serious complications. Let's dive in. The abdominal cavity houses several important systems, including the gastrointestinal system, the genital system, and the urinary system. These systems are composed of both solid and hollow organs. Solid organs, such as the liver and spleen, are highly vascular, meaning an injury can lead to severe internal bleeding. Hollow organs, such as the stomach and intestines, contain substances that, if leaked, can cause infection and inflammation in the abdominal cavity. Understanding the difference between solid and hollow organs is crucial. An injury to a solid organ can result in significant hemorrhage and shock, while damage to a hollow organ can lead to peritonitis as its contents spill into the abdominal cavity. Recognizing these signs early can mean the difference between life and death. Here, we see a diagram of the solid and hollow organs in the abdomen. Solid organs include the liver, spleen, pancreas, kidneys, and ovaries in females. Hollow organs include the gallbladder, stomach, small intestine, large intestine, and bladder. This distinction is critical for understanding how trauma or illness affects each organ. The gastrointestinal system is responsible for digestion, breaking down food, and absorbing nutrients. Digestion begins in the mouth as food is chewed and mixed with saliva. The stomach is the primary digestive organ, where gastric juices continue breaking down food into absorbable components. The liver plays a vital role in digestion and metabolism. It secretes bile, which helps break down fats, filters toxins from the blood, and regulates glucose levels. The gallbladder stores bile and releases it when needed. Damage or disease in these organs can lead to serious metabolic and digestive complications. The small intestine is divided into three sections: the duodenum, jejunum, and ileum. The duodenum is where digestive enzymes from the pancreas and bile from the liver mix with food. The jejunum absorbs most of the digested nutrients, while the ileum absorbs what remains, including bile acids and vitamin B12. The ileum ensures that bile acids return to the liver for future digestion and that vitamin B12, essential for nerve function and red blood cell production, is absorbed. Any issues with absorption can lead to conditions such as malnutrition or anemia. The colon, or large intestine, is responsible for absorbing water and forming stool. Anything that disrupts this process, such as infection or obstruction, can cause significant discomfort and illness, leading to conditions such as diarrhea or constipation. The spleen is located in the abdomen but has no digestive function. Instead, it plays a role in filtering blood and supporting the immune system. Injury to the spleen can cause life-threatening internal bleeding due to its rich blood supply. The male reproductive system includes the testicles, epididymis, vasa deferentia, seminal vesicles, prostate gland, and penis. These structures are essential for sperm production, hormone regulation, and reproductive function. Trauma or infection can cause pain and dysfunction. The female reproductive system includes the ovaries, fallopian tubes, uterus, cervix, and vagina. Emergencies such as ectopic pregnancy, ovarian cyst rupture, or pelvic inflammatory disease can cause significant pain and complications, requiring urgent medical attention. The urinary system is responsible for filtering waste from the blood and regulating fluid balance. The kidneys are the primary filtering organs, producing urine that is transported to the bladder via the ureters. Kidney function is essential for maintaining electrolyte and fluid homeostasis. Urine travels from the kidneys through the ureters to the bladder, where it is stored until elimination. The bladder, located behind the pubic symphysis, can hold around 1.5 to 2 liters of urine per day. Any obstruction or infection can result in painful and serious conditions, such as kidney infections or urinary retention. This diagram shows the urinary system in males, but it functions similarly in females. The kidneys filter blood, the ureters transport urine, the bladder stores it, and the urethra allows its exit from the body. Damage or disease affecting any part of this system can lead to complications such as kidney failure or urinary tract infections. The abdominal cavity is lined by the peritoneum, which consists of 2 layers: the parietal peritoneum lining the abdominal walls and the visceral peritoneum covering the organs. When foreign material such as blood, pus, or bile enters the peritoneal space, it can cause peritonitis, a serious and potentially life-threatening condition. The term acute abdomen refers to the sudden onset of severe abdominal pain, often indicating a medical emergency. Conditions such as peritonitis, appendicitis, or bowel obstruction can rapidly progress, requiring prompt medical intervention to prevent complications. Peritonitis is an inflammation of the peritoneum, often leading to a condition known as ileus, in which muscular contractions in the intestines slow or stop. This can cause severe bloating, pain, and vomiting, requiring immediate medical treatment to restore normal function. Several conditions can cause acute abdomen, including diverticulitis, which involves inflammation of small pouches in the colon, cholecystitis, or gallbladder inflammation, and acute appendicitis, which can result in rupture if untreated. Recognizing these conditions early is crucial in emergency medical care. The peritoneum is supplied by 2 different types of nerves. The parietal peritoneum shares nerve supply with the skin of the abdomen, meaning pain is often localized and sharp. The visceral peritoneum, however, is controlled by the autonomic nervous system, leading to more generalized, dull, and poorly localized pain. Ulcers occur when the protective mucus lining of the stomach erodes, allowing stomach acid to damage the organ. This can lead to bleeding and peritonitis, requiring urgent medical intervention. Gallstones are hardened deposits in the gallbladder that can block the bile duct, causing severe pain and leading to cholecystitis. If untreated, it may result in infection and inflammation, requiring surgical intervention. Pancreatitis is inflammation of the pancreas, often caused by gallstones, alcohol abuse, or other conditions. It presents with severe abdominal pain, nausea, vomiting, and potential complications such as sepsis or hemorrhage. Appendicitis is an infection or inflammation of the appendix. Symptoms include nausea, vomiting, loss of appetite, fever, and localized pain in the lower right quadrant. A ruptured appendix can lead to life-threatening peritonitis. Esophagitis is the inflammation of the esophagus, often caused by acid reflux or infection. Esophageal varices occur when veins in the esophagus become swollen and leak, posing a risk of severe bleeding, particularly in patients with liver disease. Mallory-Weiss syndrome results from a tear at the junction of the esophagus and stomach, often due to severe vomiting. Gastroenteritis, an infection of the digestive tract, causes nausea, vomiting, and diarrhea, often due to bacterial or viral infection. Diverticulitis occurs when fecal matter gets trapped in pockets of the colon, leading to infection, fever, and pain. Hemorrhoids are swollen blood vessels in the rectum that can cause bright red bleeding during defecation. Cystitis, or a bladder infection, is a common urinary tract infection, UTI, that can spread to the kidneys if untreated. Patients may report frequent urination, urgency, and discomfort. The kidneys maintain fluid and electrolyte balance. Kidney failure can result in uremia, where waste products accumulate in the blood. Kidney stones are mineral deposits that can obstruct the urinary tract, causing severe pain. Acute kidney failure occurs suddenly and may be reversible with prompt treatment. Chronic kidney failure develops over time and is irreversible, often requiring dialysis or kidney transplantation. Gynecologic emergencies can cause lower abdominal pain related to the ovaries, fallopian tubes, or uterus. Conditions such as ectopic pregnancy, ovarian cyst rupture, or pelvic inflammatory disease require urgent medical care. The aorta lies just behind the peritoneum. Weakness in its walls can lead to an abdominal aortic aneurysm, AAA, which is difficult to detect and can be life-threatening if it ruptures. Handle AAA cases with extreme caution. A hernia occurs when an organ protrudes through an opening where it does not belong. If a hernia becomes strangulated, cutting off blood supply, it is a medical emergency requiring surgery. Signs of a serious hernia include a previously reducible mass that is now firm and painful, discoloration of the skin, or tenderness upon palpation. Immediate medical attention is required. Ensure scene safety and follow standard precautions. Consider mechanisms of injury or illness, particularly in cases of violence. Your assessment should help you develop an early suspicion of life-threatening conditions. Assess the airway, breathing, and circulation. Abdominal conditions can impact respiration. Check for signs of gastrointestinal bleeding, such as black, tarry stools, or blood in vomit. If the patient appears critically ill, prioritize transport. Gather a sample history, asking about nausea, vomiting, changes in bowel habits, weight loss, or pain. Also, assess for concurrent chest pain, as some abdominal conditions can mimic cardiac events. A normal abdomen is soft and non-tender. Look for rigidity, tenderness, or distension. Gently palpate all 4 quadrants to assess for abnormalities. Check vital signs, including respiratory and pulse rate. Avoid taking blood pressure in an arm with a dialysis shunt. Frequent reassessments are crucial for detecting deterioration. Continuously reassess the patient, monitoring for worsening symptoms. Address shock and provide emotional support. Transport the patient in the most comfortable position. While EMS cannot treat the underlying causes of acute abdomen, we can provide comfort, prevent shock, and reduce nausea with low-flow oxygen. Immediate transport is necessary for critical patients. Dialysis is the only treatment for chronic kidney failure. If a patient misses dialysis, fluid overload can lead to pulmonary edema. EMS may be called to transport these patients to dialysis centers. Dialysis complications include hypotension, dysrhythmias, muscle cramps, nausea, and bleeding from access sites. Manage ABCs, provide oxygen if needed, and control bleeding. For dialysis patients, transport promptly. Position them upright if they have pulmonary edema, or supine if in shock. Rapid assessment and intervention can prevent deterioration.